We've known for a while now that both the Pfizer and Moderna COVID-19 vaccines are highly effective against most of the COVID-19 viruses. But a new observational study published in December of 2021 is giving us some insight into how the two vaccines stack up against each other. In this study, researchers used electronic health records pulled from the Veterans Affairs healthcare system in the United States. They selected almost 220,000 veterans who hadn't been infected by the virus and who were receiving the first dose of Pfizer's vaccine between January and May of 2021. This was when the Alpha variant was the dominant strain in the United States. They then selected the same number of individuals who received their first dose of the Moderna vaccine during the same time period and ensured that both groups had matching risk factors. Over the next 24 weeks, the researchers waited. If a participant got sick and they used the VA healthcare system, the researchers would be notified. And so the researchers started to count. How many participants were infected with COVID-19? How many of them developed symptoms from infection? How many required hospitalization? How many required admission to the ICU? And how many died from the infection? And here's what they found. Both vaccines were highly effective. Across all of the outcomes being measured, the Moderna vaccine appeared to be slightly more effective than the Pfizer vaccine. The exception was the prevention of death, where both Pfizer and Moderna were effectively the same. So why the difference? That's not clear. But we do have some theories. First, the Moderna vaccine has over 3 times as much mRNA content in the vaccine than the Pfizer vaccine, which might lead to a stronger immune response. The recommended dose intervals were also different, with Moderna being administered in 4-week intervals versus Pfizer's 3-week intervals. And recent studies support that longer intervals between doses produce stronger immune responses. Now, it's worth noting there were some limitations to the study. First, it wasn't a randomized trial, meaning it's possible there are some confounding variables present. Second, the participants selected reflect the demographics of veterans in the United States, mostly white cis men over the age of 50, which isn't super representative of the larger population of the United States or of the global population. And third, it's possible some participants may have sought medical treatment outside the veterans' hospital system, and their information wasn't completely captured in this study. So, in summary, both vaccines are highly effective at preventing infection and death against the Alpha variant of COVID-19, although Moderna has a slight edge over Pfizer in most outcomes. If you want to read more, we've left a link to the article in the video description. If you liked this video and you want to see more summaries of medical literature, like this video and leave a comment. Figure One is a secure digital platform where healthcare professionals can share and collaborate on real-world clinical cases and images. Register for Figure One and be part of the largest global community of healthcare professionals exchanging knowledge to improve patient outcomes.